Hello people, in this video let us look at this question that has been asked. Mention the arteries forming the superficial palmar arch and name the branches from it. It has been asked only for 3 marks. So palmar arch means what? On your palm, correct? So basically when was this question asked? It was asked in November 2023 in anatomy paper. So you should learn this. So look at this. First you draw a palm, right hand, preferable palm. You can see how it's drawn here. Then there is a superficial palmar arch here, which I'm drawing in blue. Can you see? Very simple. Just draw a U like this. So this side you have ulnar, and on the lateral side you have the radial artery. Okay. So ulnar artery mainly gives you the superficial palmar arch. Remember, it is superficial. So deep also one more arch is there. So which are the arteries which are forming superficial palmar arch, they have asked. So which is the artery? Ulnar artery, and then it is completed on the lateral side by the radial artery. So these two words if you write, it's enough. Okay. Diagram drawing is very important, remember. Next, what have they asked? Name the branches from it. So from this superficial palmar arch, what are the branches they are asking? Okay, so first of all, what have they asked you? Name the arteries which form the superficial palmar arch. For that you will write ulnar artery on the medial side and radial artery on the lateral side. Now what are the branches which come off the superficial palmar arch? You have to say that there are 3 common digital arteries and 1 proper. Okay, so that's all you have to write. How many? Total 4 are there. 3 common and 1 proper. So the branches are 3 common and 1 proper. So you can look at this. 1 proper means it's going only to one of the fingers, that is this finger, which is supposed to be the 5th finger, correct? And then you have the 3 common. You can see how the 3 common go like this. They are supplying 2 fingers, right? So 3 common and 1 proper. This is what you have to write. That's all, okay? And these common ones, see these common ones below, they are joined from deep also. But this and all they didn't ask, right? From deep also some branches are coming which are joining these. That you don't have to write. All you have to write is there are 3 common and 1 proper, okay? And you have to draw diagram. Now how to draw diagram we will see. Okay, so the diagram should look something like this in your paper. Much more beautiful because you will be drawing it in paper, correct? So now let's take a new slide and try to draw. So first of all, look at your right hand and try to draw a nice hand. See, I'm drawing on a laptop, right? So not that I will not be able to draw very nicely, but I am trying to draw. So this is the palm. So you first of all label this. So this is the right hand palm that you have to write here. Okay, right hand palm. Now you have to draw the superficial palmar arch. Very simple. So here you have the ulnar and then here you have the radial. So label this as what? Ulnar artery, and this one you will label on the lateral side as what? Radial artery. Now you have to draw its branches, right? So 1, okay, 1, 2, 3, 4, 5. Correct? Only have drawn, right? Yeah. So these 3 peaks, whatever you want to call, depressions or whatever, to that I have joined these 3 lines. Okay, those are the 3 common, 3 what? Common branches of the superficial palmar arch, like this you show. Okay, and then 1 proper. 1 proper you show like this. That's all. So 3 common you label and 1 proper. Okay, 1 proper digital. I think they're calling it as digital branches. Okay, and in anatomy exam, in every question at the bottom, 1 line you should write clinical anatomy. Why is it important, right? Why you are reading this topic. So basically you should say the superficial is joined with the deep palmar arch branches. That is not actually clinical anatomy, but what you should know is the blood supply which is provided to these 3.5 fingers is from the superficial palmar arch. That much you can write. That becomes clinical anatomy. So that will give you a complete picture, complete marks they'll be able to give.